T-Bone and Heather in the morning on Star 98.3 and 97.7 The Bay.
4 minutes after 8 o'clock, 8:04. Good morning, one and all. We've got a special guest in the studio, Dr. Larry Polsky. Welcome, sir. We've had you on the show many, many times, but you're in-house, as they say.
I love it.
It is a pleasure to be here. Good to see you both.
Pleasure's all ours.
Good to see you.
You have had an eventful year. We all have, but you have had probably more so. We were talking about this earlier. I know when you're in the healthcare field, there's always the possibility that something like this will happen, albeit a very remote possibility. But look at you. You drew the lucky straw. Here you go. Here's a pandemic. And it's been just a weird year for all of us. And I got to imagine it's been a strange learning curve for you guys as well, right?
It's been the strange kind of dichotomy that, on the one hand, watching science evolve in real time has really just been fascinating. On the other hand, and it's almost like you have to split yourself in half, that you realize that people are suffering. Unfortunately, there are a lot of people who've died. And so it's that flipping between the humanity aspect of things,
right,
and then just the pure science and, in some ways, the excitement of this whole learning process.
Yeah.
Mm-hmm.
And trust me when I say this, I'm not holding you to anything. But what is,
like you could.
Well, I'm not just saying Polsky said. I'm not doing that. But where do you think on the line of the pandemic? Where are we? Are we? Can we see a finish line? Is that something, or maybe not so much?
Well, I certainly think that we're much closer to getting back to where we want to be. And, of course, the one thing that we can't really take into account is, will there be future variants that may throw us back a step or two? Even if that happens, we know so much more about this virus now than we knew a year ago, that even if we should end up with some variants, the ability to control it is going to be greater. And I think that the big issue is that the scientific knowledge that we've accumulated, is that going to be put into action by people out in our community, people across the state? And really, we know this is a pandemic, people across the world.
Yeah. We were talking before we came to work this morning. There was a thing on the news. I think, I know Waldorf was one of them, and there was another one.
In Prince George's County, I believe.
That's probably what it was. No appointment necessary if you want to come get a
drive-through.
Yeah, just pull up. They'll get you vaccinated. And my sense was,
everybody who wants to be vaccinated is now vaccinated.
Yeah.
Now it's everybody else.
I get this feeling that people maybe that aren't vaccinated at this point, not going to get vaccinated.
I mean, what's your thought on that, Doc?
So the people who are just had this need to get vaccinated, I think that all or almost all of them have been vaccinated at this point. But I don't think that everyone else is I'm not going to get vaccinated. There are a lot of people, I think the majority of the people that are left there's some degree of uncertainty, and they need to feel more comfortable. Part of that is going to be every week that goes by that we see people continue to stay healthy, that we don't see people hospitalized who've been vaccinated. That's going to make a difference. We've seen that over and over, everything from EMS workers to people who work in hospitals, work in daycares, where once they see some of their coworkers do okay for a certain amount of time, then they feel comfortable getting vaccinated. The other is that there are a lot of people, I think they need to have a conversation with their doctor, with their nurse practitioner, in the context of their health, why this is important for them, and also why this is safe for them to do, and then those people will move forward. And for the most part, the strategy of getting vaccines out to mass distribution sites was necessary given the need to vaccinate so many people so quickly.
Right.
But we're at a point now where I think a lot of this should be shifted to doctors' offices. And
But doctors' offices don't necessarily have the refrigeration like for the Pfizer or the Moderna. Is that an issue?
And for most doctors' offices, that's not an issue.
Really?
Oh, really? Okay.
So beginning, the Pfizer was minus 70 degrees.
Right.
Right. So we've learned, and again, they were being as careful and conservative as they could in the beginning, and then they start to learn, well, you can relax some of those restrictions.
No
so
kidding.
Normal refrigeration temperatures are good for a week. So you can't give it to can't give Pfizer to a doctor's office and let it sit there for a month.
Right.
But if it's a busy doctor's office and they know that they can vaccinate 100, 200 people in a week, they can get those kind of allocations.
Oh.
Moderna is a little bit more forgiving, and so that can stay longer in a refrigerator that would typically be in doctor's offices.
I had no idea.
Yeah.
Oh, that's clever.
We're talking
Okay.
with Dr. Polsky, Health Officer at Calvert County Health Department.
And unfortunately, too, these folks and just people that I've talked to, friends and family who are not going to get vaccinated for whatever reason, we're fighting myth, I think, urban
How
legend.
tough is that for you?
I mean, it's
when
going to change my DNA. I'm
Yeah.
not going to get it.
Bill Gates is tracking us. It's going to change our DNA.
It's going to, I mean, is the Pfizer or the Moderna, because they're different than the Johnson & Johnson, are they going to change your DNA?
None of these, absolutely none, will or can change your DNA. I think it's
Okay.
important. It's not just a question of if, but we have hard scientific knowledge that mRNA, which is what's in the Pfizer and Moderna vaccines, there's a one-way street, essentially. When we produce our own mRNA, that it gets produced in our nucleus where our DNA is. And
Okay.
then once it's produced, it goes out of the nucleus into the cytoplasm, which is the bulk of our cells.
Okay.
And then that's the template to manufacture proteins, which we need to survive.
I've said that 100 times.
Now what? Now
When-
what about
when you get the
this?
vaccine,
The vaccine, right?
It's coming in through the outside of the cell directly into the cytoplasm. It cannot get back into the nucleus any more than our mRNA that naturally gets produced ever goes back into the nucleus.
Okay.
So we knew
it's
that
not going to
anyway.
change your
No,
DNA.
it's absolutely impossible for that to happen.
Okay. So that's one myth that is gone. And there
Well, I can
is-
assure you it's not gone. But
Okay, but there is a history with mRNA, because this is another thing I've heard. We don't know anything about the way that they designed this vaccine. There is no precedent of mRNA. This is an entirely new thing. We've never seen this before on the
that true?
planet.
And so that's where you need the buzz,
Right.
false
Oh, I got
sound. Thank you.
yeah.
That mRNA vaccines
Oh, no.
actually have been in gradual development for about 30 years.
Wow,
And
okay.
gradual development because vaccines have always been underfunded. So research goes slowly with vaccines. Certainly what's happened over the last year and a half has accelerated that. But there's been gradual incremental improvements in mRNA vaccine technology. There have been several other vaccines that have been produced, but they've been used for unusual, like Ebola, where you're not going to have mass distribution.
Zika.
Right.
And what eventually at this point has happened is the technology was right up to the edge of where it was ready for prime time, and then you got this huge influx of research money that pushed it across the finish line.
Okay, can I say this too? I'm hearing this. Well, the FDA just pushed it through. I mean, they haven't tested these. There hasn't been enough trials
I
for
think
these.
that's
We
the
don't
most-
know what it's going to do. The FDA, it's just an emergency. Bam, it's in, and now it's in our arms.
That is the most common thing I hear
Yeah,
in,
me
in
too.
some version of that.
not enough testing.
There's not enough testing. They don't know what it's going to do.
These vaccines have been tested just as much as any other vaccine, just the timeline was accelerated. And the reason for that is that typically there are a lot of new drugs that are coming into production, new vaccines. Nothing really gets prioritized. You just get in line. Like, you're just waiting at the line at
Right.
the, Walmart.
Sure.
forever.
Right,
Now,
right.
all of a sudden with this, they just shoved everybody else out of the way, and then they moved this up to the front of the line.
Okay.
So the pace at which they were able to complete the trials was much faster. But actually, when you take a look at the number of people included in both the placebo and the actual vaccine part, and you look at age diversity, because oftentimes with other products, it's only tested on very healthy people. There was a much broader range of health conditions, ages, races, ethnicities. So in some ways, this is actually the best tested vaccine out of anything that's ever come to market.
No,
Okay.
yeah, that's interesting because I think with other vaccines and situations, they had the luxury of time.
Correct.
And this one, not so much. We needed to know right now what was happening.
And do you think, doctor, that the way they rolled it out with, of course, people in the healthcare field, first responders, but it seemed like this virus really went after geriatrics. They went after the older population, and that's who we vaccinated first, was the older population. Are we seeing the numbers and deaths drop because of that?
There certainly is a significant, really a huge drop. We haven't seen any deaths in nursing homes, at least locally, in
Wow.
months.
Wow.
Since people have gotten vaccinated.
That's
Huge.
amazing.
See, this is the kind of news that needs to get out.
And just in the general community, We are still seeing, unfortunately, people in their 60s, 70s, 80s hospitalized, but those
Right.
have been people who unfortunately have not gotten vaccinated.
Mm-hmm.
So in Calvert, and the stats are very similar in St. Mary's and Charles County, 75% of seniors have completed their vaccine series and 85% have gotten at least one dose. But that still leaves 15% of people
Right.
who are completely unprotected.
Right.
But we're seeing actually a much larger number of people hospitalized in their 30s, 40s, and 50s recently, and that's because of the UK variant.
Oh, so
primarily.
so we have the UK variant in Southern Maryland.
Thanks, England.
And
Yeah.
and that's now the predominant strain in the whole state.
And there's
No
Brazil.
kidding.
The
Right.
Brazilian one is out there too, correct?
It's just the numbers
Not
for the
here.
Brazilian is still very small.
Okay.
There have been some cases in Maryland, but the UK variant is now.
Okay.
If you get infected, it's most likely that you've been infected with the UK
Okay,
variant.
and I know people are going to freak out though when they hear, "Oh God, UK variant." What is the difference between the UK variant and regular old COVID-19?
Tyranny.
Monarchy.
Right.
The UK variant attaches and infects more readily. So going back, and this is science changes, and I think people get frustrated because, well, you said this 6 months ago, and now you're saying
Yeah,
something
right.
The
else. Well,
mask thing, yeah.
the natural world changes over time.
Okay.
And in ways that are not predictable. So we were saying, a year ago, even 6 months ago, that the children were less likely to be infected. With the UK variant, we have seen that change dramatically because this virus infects everyone more readily. So we've
Including
seen
children.
Including children.
Have you seen children in Calvert County with that have become sick with the UK variant?
It's a combination.
can you not say?
We've seen them get. We certainly seen them get sick. The numbers have risen.
Okay.
It certainly impacted daycares. It's impacted sports teams.
Yeah.
That we've had to unfortunately shut sports teams down for 10 days or so.
Right.
And I think daycares, in many ways, from a practical standpoint, is maybe the biggest issue because that means that parents, they can't drop their kids off at daycare for the next
Right.
and
14 days or
it's
whatever.
14 days, but yeah, for the state for daycares.
So if a person, namely me, because it's all I'm concerned about,
You've been vaccinated.
I've been vaccinated.
Can he get the UK variant and become sick from it?
None of the vaccines are 100% protective. There are
Right,
two
right.
huge benefits from the vaccines. One, the chance of you getting infected, and the vaccines that are currently available are effective against the UK variant.
Okay.
Okay.
So the chances of you getting infected are much less.
Right.
So that's number one. And then number two is if you should get infected, a smaller chance. The potential for you to get seriously ill is next to zero. And we have still not seen any deaths in people who have
So
been
it's
fully
good.
vaccinated.
It's good news.
Okay,
Yeah.
let me ask you this because this is one I hear a lot. We got the boy vaccinated. He got his first shot of Pfizer a couple of weeks ago. And talking to friends who have teenagers, especially girls, no way, not going to give them the vaccine because there could be birth defects when they decide to have children.
Everybody cites that.
Birth
I don't
defects.
even know what it was. You probably
I mean,
do.
so
but,
many
back
people-
in the day, kids were born, with the lobster
Because
hands
they were
and stuff like
because
that.
they were taking the mothers were taking the anti-nausal drug. I can't remember what the name is off the top of my head, but now they're equating what happened in the 60s to this vaccine. Do we know enough? Do we know enough about, because the CDC has now said, this came down the pike yesterday, that they're telling pregnant women, before they were saying get the vaccine to pregnant women, and now I guess yesterday they are saying pregnant women need to educate themselves on the vaccine. We still think it's a good idea, but educate yourself before you get the vaccine. I mean, what is a pregnant woman or a young woman who wants to have a family one day? How are they supposed to conceive all this information that's floating out there?
None of the vaccines cause birth defects, and there's absolutely no evidence of that at all. I think that advice for pregnant women to educate themselves, everybody should educate themselves.
Right.
The American College of OBGYN.
You're asking a lot.
Well, and it's a question of where do you educate yourself?
Right.
And the American Society for Reproductive Medicine, which is a society of physicians who specialize in fertility, both recommend that for women who are pregnant or are planning to get pregnant to get vaccinated. And the reason for that is that there is now an increasing amount of evidence that shows that when a woman is pregnant, if she gets COVID,
Right.
that her likelihood of having more severe illness is greater than another woman of the same age who is not pregnant. So the idea of protecting yourself, and we say the same thing for the flu.
Right.
And this is one of those things I think everybody needs to pause and take a step back. That vaccines have saved more lives than any other medical intervention that we have ever developed. And there is not a parent in America who worries about their child becoming paralyzed from polio, developing blindness or deafness from rubella, dying from smallpox. There are teenagers who are spared the devastating and sometimes fatal effects of meningitis.
Meningitis B, right.
And for older people, pain from shingles is horrible, and pneumonia is oftentimes fatal. Vaccines prevent all of that with an incredible safety record. There is not an antibiotic that I can prescribe for any of my patients that are as safe as any of these vaccines.
Really?
And there's certainly no surgery that anyone can have that is nearly as safe as any vaccine. And we have allowed social media and we've allowed cable news to convince us, to make us incredibly paranoid.
Yeah.
Right.
To the point where we're depriving ourselves of something that works so well. And it's not, in this case, just the health effects, but we look at the economic effects, we look at social isolation.
Yes.
That, these are vaccines that are truly game changers in both health and society in general.
Okay, now I'm going to ask you to go out on a limb because T and I talked about this yesterday, and that was, I don't even know if I should ask you this, but I'm going to anyway. Do you think we've reached herd immunity? I mean, not just with the vaccination,
listen,
but
this is where I sign on to
this
a little
is
bit
what
of the
he
conspiracy.
says, doctor, and I think it's a full
let me
bunch
preface
of bunk, but go ahead.
She thinks it's bunk, but I think it has merit, and you're smart, you'll agree. Here's what I'm thinking, okay? So we have a number of people who have been vaccinated. I don't even know what that number is, but put that number, whatever it is.
41.5% in the state.
See, you know stuff.
In the state.
So we've got 41% of the people who have been vaccinated in this great state of Maryland. We have another percentage of people who have had COVID. They've gotten over COVID. Maybe they had COVID, didn't even know they had COVID, got over COVID. So those people have a certain amount of antibodies in their system. If you take those two numbers and put it together, don't we have that magical 70%
or 8?
of herd immunity?
What do you need for herd immunity?
So we clearly don't, because last week in Calvert, we still saw over 150 people diagnosed with COVID. And that does not include people who, for various reasons, didn't get tested because they didn't have symptoms or because they had symptoms and didn't want to get tested. So we are still looking at levels of infections comparable to where we were back around Thanksgiving.
Really?
Now, it's important to keep in mind that there are a significant proportion of the population who is really protected, but there's still a chunk
So
of
how do
people
we
out
make
there.
that jump? How do we ever get to herd immunity?
We need more people to get vaccinated. So 41% is great, but 41% is not,
Not
70,
enough.
80%.
Why can't we just fly over people and spray them like we do mosquitoes?
We got to get the government on that.
This seems like a no-brainer
I
to
think
me.
we should keep the government out of that, to be honest with you.
Dr. Larry Polsky, thank you so much for making time with us today. I know, and I've said it before, I'm going to say it again. I hope it's not just lip service. Thank you and your staff and in all the departments who have been working to keep us healthy, keep us safe, keep us alive. I don't know how anybody could ask more of you guys. You've worked yourself silly. We appreciate it. I'm sorry to tell you that you probably have more work ahead of you.
Yeah.
That said,
I have your number. I have your number.
Could everybody out there listening maybe make his job a little bit easier and go get your damn shot? That would be nice. Go do that.
And I think you dispelled a lot of rumors. There's going to be people out there, obviously, that are just,
they think you're...
Q told me.
Well,
and
look,
it's
they
like,
found another puppet for the government.
And I can't emphasize enough that for people who are uneasy about getting a vaccine, talk to your doctor, talk to your nurse practitioner.
okay, can I say this? Because this makes me angry. I have people who say, I've talked to my doctor, and my doctor says don't get it. My doctor... and
Would any real doctor say that? These are crazy doctors, right?
I cannot believe it. I don't know, and I talked to almost all the doctors in Calvert. I practiced in St. Mary's for years. I still know quite a few of the doctors. I personally do not know a single physician who says that their patient should not get
Okay, but when you drill down to it, they're holistic healers.
Okay.
I hear a lot about they say my doctor. Their doctor has a degree in alternative medicine, which, there is a community out there that does that. But I think in an instance like this, instead of saging your house, maybe it would be a good idea to talk to somebody who has a degree in internal medicine or something and ask them about the vaccine.
Well, I mean, you always see it on TV and stuff. You know, they always give this stat. There's some dentist out there that doesn't believe in brushing.
Right,
9 out of 10 dentists.
Right, one doesn't believe in fluoride.
You don't need to floss.
Well,
don't buy into that.
He's the richest dentist in the whole
He
state.
sure is.
That's right. So,
Dr. Polsky, thank you so much for coming in. We appreciate it. I know you've got probably another busy day ahead of you. Anytime you want to come in and chat,
we'd
please. The
love
door's
to.
always open.
And it was just because we ran into you at the auction and we're like, hey, what's going on?
Yeah.
And I was like, oh my gosh, I have so many questions for you. And I'm so glad you made time to come in and talk to the listeners and hopefully dispel some of those rumors, because they are rumors and they're preventing people from getting vaccinated.
It was my pleasure, and thank you for making the time to allow me to come in and join.
What else are we doing?
Oh, yeah, we're not doing anything else.
8:24. Let's get a check of the weather.